Hey guys, my name is Emi. I am coming live from Home and Rehab at Claremont, and I'm here to talk to you guys a little bit of falls risk strategies, risk management, and things like that for anybody who is an increased risk of falls, or if you know someone that has an increased risk of falls. We're going over some tips, kind of like in a little series of things to watch out for, things to keep note of, in order to keep you or your loved one safe. So one of the topics we'll talk about is medication management. And there's a lot of ways that this kind of plays into your balance as well as your risk of falls. So as we get older, with the different doctor's appointments and things like that, it can be easy to kind of rack up the amount of medications that may be under your medical history. Depending if you have different doctors or physicians or different providers that you may go to, they may each give you a different prescription. The problem kind of arises sometimes if there's not communication, or if you go to too many providers or things like that. Sometimes they'll either not pay attention to the other doses or other medications, and you may find yourself having multiple medications that may affect you. So in some of these ways, for example, blood pressure medications, in certain cases, blood pressure medications have been prescribed by multiple physicians, and at the end of it, the one patient may have 3 blood pressure medications and they may not even realize it. So there is a term called Polypharmacy, which essentially means excessive and overuse or misuse of medications. And these issues can kind of affect your balance in the sense that depending on how the medications react, they may increase your risk of falls. For example, my previous example of the blood pressure medications, if you're on too many blood pressure medications for your high blood pressure, it can tank your blood pressure and you might have more issues with feeling really dizzy, really lightheaded, and it may affect your balance, especially if you're trying to stand up really quickly or sit up really quickly, and some people find that they either lose their balance or may fall. Another one would be if you're taking any pain medications. A lot of times they make you really drowsy. And again, that might affect your level of consciousness, how aware you are of your environment, and it may increase your risk of falls. So we're going to go over a couple of tips to go and make sure to keep yourself safe, as well as communicate with your physicians, your physical therapists, and your pharmacists about what are the best options for you. So first tip I always give patients is to keep track of your medication. So depending on who your primary care is, cardiologist, whoever it is, it's always a good idea to keep a running list, whether typed or handwritten, of all the medications you have. That way, whenever you go to a new physician or a new doctor, a new appointment, you already have a list ready for you, so that when they ask, are you currently taking any medications, you have it ready to go, and they'll know what's already in your medical history. As well as when you go to your pharmacist. Some pharmacists will let you know, or they'll ask you, are you currently any under of these medications and things like that. That way you'll have your list ready. That way they can see what you're already on, and they'll see what side effects may happen in order to keep yourself safe. So they might talk about dosage changes, they might ask about changing out your medication, whatever is best for you and to help decrease your risk, the pharmacist or the physician will be able to talk that with you. So questions to ask when you're in the doctor's office or the pharmacist is you have the right to ask them what the medication is for, what is it targeting, what are the side effects. That way you can also increase your knowledge of what's to expect, and even if you don't remember the name, you remember if this is for blood pressure, you can let them know like, hey, I'm also taking medications for blood pressure. These are the side effects. So at least they'll know kind of how to dose and what medications to give you to keep you safe. You also want to make sure with physical therapy, if you're going to your physical therapist, you're also letting them know of any medications that you may be under. This can help us kind of determine what's the best course of action for you. There are medications that, like I said, some affect your blood pressure, some affect your heart rate, some affect your respiratory, how you're breathing and things like that. So while we're doing our exercises and coaching you through your rehabilitation, we want to keep you safe, and sometimes exercise in combination with some of those side effects may lead to other things. So it's best for us to know what to expect, especially with your medications. Let us know if there's anything out of the ordinary or anything you're feeling with your new medications and things like that, so that we can keep an eye on you when you're doing your rehabilitation. Another thing to consider is when you're starting new medications. You always want to be wary of any side effects. If you start feeling dizzy, any increase or nothing or no changes happen. That way you can let your doctor know or your pharmacist know that either the medication's not working or it's giving you these weird side effects, so that again they can take the chance to walk you through it, change your medication if it needs to be, and just do the best that they can in order to keep you safe at home